forward with that. He and I spoke over the weekend about that, that it is critical that we be fully transparent with everybody so everybody becomes part of the team. The information is sobering. RNAO is not, unfortunately, surprised. We have warned for many, many weeks and over a month, in fact, to start before with some of the measurements. We are now at the situation that, you know, as the Premier said, some chapters have been written and we cannot rewrite them, but we do have a final chapter, and I echo what he said. We do have a final chapter that we will all write together as a people. And that final chapter has to do with how many people will succumb and die. Not how many cases will be ill, but how many people will we have that we will have lost in our families, in our communities, in our workplaces. And that's the chapter that the pen belongs to absolutely everybody. So my first plea goes to the public. Many of you have heard me through the media pleading to you to stay home. Even before the province said stay home, and we were talking only about social distance, I kept saying, stay home. I want to echo what the Premier, what the Prime Minister, what the Minister said today. Stay home, please. I just yesterday heard about a park that is full of people with young children in the slings as if life, it continues. You are putting yourself at risk, your children at risk. 4% of the people that contract this virus are children. Stay home. I know my kids are staying home and it's difficult for me not to see them, but they and their kids are staying home. I beg you as a nurse leader to stay home. Unless you are an essential service, please stay home. Second, for the government. For the government, the first priority, Mr. Premier and Minister Elliott, and you and I have discussed this many times, is this: simple masks, number one. These can be produced overnight. These are not difficult to produce. If we want to shave the curve of outbreaks in nursing homes, and Minister, we already have 55 outbreaks in nursing homes, people dying in nursing homes. We can change the chapter of that book also by actually sending today to every single nursing home the surgical mask and making sure that every single person walking into the nursing home is wearing the surgical mask for the entire time. Absolutely, we must do it. Otherwise, we are bringing the outbreak to the nursing homes, and it will be a horrible, horrible chapter in our history. We must protect our older persons with actions, and the action today is to send surgical masks, hand sanitizer to every single nursing home in this province. I have been begging for this for weeks, and I desperate about that. We are now sending them after an outbreak. We must send them before. Third, to the Premier, to the Minister, and to all the health officials, we must ramp up the testing. We are not doing enough testing in this province. We need to ramp up the testing to massive amounts. And with that, we need to ramp up the case tracing. Now that requires an army. We have that army for you. And I have repeated that again. We need to do case testing, case tracing, and we have the people to come and help. For our colleagues in hospitals, I know and we know you will have it very tough in the weeks ahead. We know you're preparing like for a war, and yes, this is a war. We know you are opening spaces, for ICUs, you are trying to get more ventilators, and ventilators is a must to save lives. Let me say this, you will need the nurses for that. And let me give you a glimpse of hope. We have 700 registered nurses with critical care expertise ready for you to come. Please do not wait till middle of next week when the crunch is in. Bring the surge capacity today. Bring the surge capacity today through Via Nurse that is in RNO website, RNO Via Nurse, free of charge. We set it up 3 weeks ago, free of charge to employers, to the province. It's a service for you. Bring them on board now. Do not wait until we are scrambling. Please, please, please. Lastly, to our colleagues, nurses, doctors, respiratory therapists, and everybody else that will be at the forefront of this war against COVID. Please know we are with you, as we have been every single day from day one. We are with you, pushing the right agendas, being transparent because we are, and helping you to get through this tunnel because there will be a light at the end of the tunnel. And hopefully that light will be a light that we will look in the mirror and all feel that we wrote the best chapter possible for that last chapter of the book. With that, I will open to questions for the families of older persons. We set up a forum for you to connect. We have the resources for the long-term care organizations to help you. We are sending thousands of nursing students to work as PSWs. Please know you are older people, your families, your grandparents, your friends. Not everybody in a nursing home is older either. They are not alone. We will be side by side with them, accompanying them because we know how difficult it is for them and for you not to be able to be together. Our hearts is with you, with all of you, with all of Ontario, with the government, and with everybody else. And I will open now to questions. We are ready and eager to support everybody in these very, very difficult and tough times.
Hi, it's Janella Massa from City News. I have a question. I just wanted you to clarify a little bit about the 700 nurses. Are those the nurses that have come out of retirement, or sorry, where are those numbers coming from, and what is it that you're asking for?
Thank you so much. So first of all, we have about 6,000 nurses that RNs that can serve in any area except of critical care, though, and then I will tell you who they are. We have about 700 critical care nurses, so that's a specialty. We have about 150 nurse practitioners. Those are the ones that can describe, can prescribe, can prescribe medications, tests, etc. And we have 5,000 nursing students who can work as PSWs because they're allowed after the first year to work as PSWs. The nurses that are in Via Nurse are nurses, a small percentage are nurses that retire. Another percentage is faculties of nursing that do clinical work, that now will do full-time clinical work. Another portion is nurses that were working full-time, either because they didn't get full-time before, because that was the situation in this province, or because they didn't want to work full-time, but now they will be working and they're putting their names in numbers that are inspiring. So they're ready to serve the public. We have already deployed a very good portion of students to nursing homes to work as PSWs, to hospitals. We are already served a few of them. We want all the hospitals to build the surge capacity now for critical care and for any other unit. You have the people. It will take a few hours. That's all. You tell us who you are, what you need, and in a few hours you will have the people. And then, of course, in other sectors, again, we're ready to help.
So just to clarify, these 6,000 nurses are basically on standby waiting to be assigned.
Correct.
Responded to the call.
Correct. And let me tell you, they have been in standby for quite some time. The minister knows that we wanted to push more nurses into telehealth, public health units as they do the case tracing. If they need more people, let me give you an example. Ottawa Public Health Unit. Were the first that took 60 of these nurses to do the case and contact tracing. So they're ready to go. They want to help. They want to do it. They want to do it now.
So of those 6,000, have any been assigned or just a small percentage?
Yes. A good percentage of students have been assigned of the 5,000, but there are at least 4,000 still that can be assigned. And out of the 6,000 in critical care plus general, a very small percentage, as I said, by public health unit, by some of the indigenous authorities, by a few of the hospitals, Michael Gueron took some, etc. We are saying now is the time. People seem to be waiting. It's a bit like the public. The public was waiting until things to get worse to take seriously the situation of staying home. Sometimes healthcare organizations have a difficult time wrapping around that opening more ICU beds, bringing more ventilators, and bringing a surge of, you heard how many people, that they will be ready to go. No, they need the human resources ready to go. And if we learn anything from Italy, and RNO is in daily touch from the beginning with Italy and Spain, with the nurses there, what failed them at the end was human resources. They had places, ICU opens with no nurses to staff. And nurses, RNs with critical care need to be already coming there and being ready to help, so that we don't wait for the crunch. We are proactive about that and not reactive, which sometimes we are.
Thank you.
Any other questions? Okay, we will have another one in a couple of hours in case that other people want to join. Thank you.